All right, y'all, we'll go ahead and get started. Okay, so we're super excited for y'all to be here today. We're gonna have a fun little cooking demo first by Zach Lump. He is a dietetics graduate student, so we're gonna have a fun little carrot salad. So y'all get to snack on that while we have our presentation by Dr. Savannah Huckaby. Before we get started, I did want to have some BeWell reminders. So starting from today, we have 44 days till our deadline. So October's coming quick, y'all. I don't know about y'all. I don't know where August went, but I feel like it came and went and left. We do have that sleep challenge open till the 12th of October. So you just track your sleep 3 times a week and that's it. Pretty simple. It doesn't matter how long. I mean, you could sleep for 20 minutes. You're still gonna get your points, obviously. So, and then no matter, even if you don't win, as long as you track 3 times a week for the duration of the challenge, you'll get your 10 points. So sometimes there is confusion on that. First place winner will get person that gets the most amount of sleep. They're blessed because they got the most amount of sleep. And they'll get $50 in bear bucks. And then everybody else will be put into a random raffle to win either a essential oil diffuser and some essential oils or a UCA blanket that was gifted by the UCA bookstore. And it's a very nice blanket. I wish I could keep it for myself. Other thing I was gonna say, if you are close on your lifestyle board of like kind of bridging the next gap to getting, you know, the max amount of points, and you're like, I don't really know what could I do to get to that point, just reach out to me and we can have a phone call. I can kind of say like, hey, have you done this? Or kind of talk about some ideas on kind of bridging that gap. And then afterwards, we'll send you guys a post survey of the presentation. If you'll just fill that out quickly and then not quickly, but just fill it out. And so we can kind of, you know, improve on the presentations and then get feedback. You do have a handout at your desk. In this, it printed funky, but it's got the recipe that we're going to do today on there. And then it also does have some eye health tips on there as well. And for those that are on Zoom, you will be getting this also in the post email as well too. So that way you can have a copy as well. All right. Well, he will do the cooking demonstration and then we'll pass it out while she talks so that you can snack while she presents. I'll go ahead and switch it over to you.
There you go.
I'm gonna get the camera set up. Quick. You can go ahead and kind of talk about carrots if you'd like.
All right, so for today's cooking demo, we're gonna be making a carrot salad. As the recipe says, it's an easy carrot salad, so it shouldn't be too hard to make. And you guys might already know kind of why we might be cooking with carrots when it comes to eyesight. Does anyone know what kind of nutrient is in carrots that is good for your eyes? Yeah, you said A though?
A.
Yeah, vitamin A, beta carotene. So as everyone knows, carrots are good for your eyes. My mom used to always say that growing up. One time she told me and my friend, she was like, well, you never seen a rabbit with glasses, have you? And my friend was very quickly like, yeah, the white rabbit in Alice in Wonderland. So yeah. He must not have ate a lot of carrots, he was maybe more like a lettuce rabbit. But vitamin A, so carrots are gonna have like beta carotene, your body's gonna convert that into vitamin A, and then vitamin A is kind of what you need to use to make rhodopsin. And rhodopsin is something that is good for your retinas. It protects your retinas like in the back of your eye. Probably heard people say like, you know, it's burned into my retinas. That can actually happen if you like stare out in the sun too long. It will actually burn your retinas and really mess with your vision. So if you learn anything today, don't stare directly into the sun. So rhodopsin, it kind of sounds like a flower, like, you know, for some reason I just think it's like somebody's just like, yeah, I was just watering the rhodopsins yesterday. But so Madeline had already shredded some of these carrots, but I was going to show you guys. This looks just like a corncob pipe, but it's actually like a carrot spiralizer. But you, for this recipe, can do it anyway. If you want to shred it, if you want to get like even just, you know, free matchstick like carrots, you can do that as well. So yeah, with this, you literally just put it in there and twist it. It's like sharpening a pencil, basically. So funny thing with vitamin A is that actually if you have too much of it, it can be toxic. So vitamin A, like if you see supplements like multivitamins, a lot of the time it won't have like a whole lot of vitamin A in it. It might have like 100% vitamin C, 100% vitamin B, but when it comes to vitamin A, it might be a little less. If you have about like 10 times of the recommended daily allowance of vitamin A, it would actually be toxic to you, and that's not good. But that's really just with supplements. With dietary vitamin A, there's really no limit. But if you ate enough vitamin A, or foods that contain beta carotene, I should say, you can get something called uh, carotenemia. And has anyone heard of Magic School Bus? So you might remember an episode in which Arthur ate so much of this snack called seaweedles, which looked like a Cheeto, but it was like made with seaweed or whatever. He ate so much of it that he turned orange. And that actually is a thing. Like in real life, it's really more just like the palms of your hand or like the bottom of your feet. It'll turn kind of yellowish and orange. So yeah, it's kind of crazy. And on the subject of like seaweed, you guys know flamingos are actually not born pink. They're like born gray, but they eat a lot of algae, which has beta carotene in it, and they eat a lot of shrimp, which, eat the algae as well. So the way a flamingo's like physiology is they basically, when they convert the beta carotene to vitamin A, it's stored in their feathers and their skin, and that makes them kind of look, pink. Not really orange. It'd be cool to see like an orange flamingo though.
Yeah.
All right, so this really is a good amount of carrots. The recipe says 12. I mean, you can always cut this recipe in half. I know Madeline, when she was looking at it, it needed like a lot of olive oil. So we kind of cut the olive oil in half too, because
Well, in that
very
recipe,
big.
that was to make bigger amounts for you guys. We do
Mhm.
have the smaller recipe on the back of your handout as well too. But
All right, so we got this spiralized. Looks really weird now. So the spiralizer, it does make very long ribbons. So by hand, I'm just gonna kind of break this apart a little bit. And then we're gonna move on to make the dressing. So obviously, if you're in a time crunch, you could use just like, store-bought dressing. But it's fun to make your own dressing, and I mean, let's be honest, it wouldn't be that fun of a food demo if I just like pulled out a bottle of ranch and just dumped it on here. So yeah. So with the dressing that we're gonna be using, it's gonna be should I mix this into a bowl first and whisk it or just directly in? Okay.
mix it all up.
So we're gonna be using 3 tablespoons of olive oil. The recipe called for 7.5 tablespoons, but yeah, that did just seem like a lot. We're doing 3 tablespoons of soy sauce, 3 tablespoons of rice vinegar. Then the recipe said 3 to 6 teaspoons of honey. I kind of went in the middle. I did about 4 teaspoons, but if you like it sweeter, you can always add more. Then it calls for just a splash of lime juice, so just one little splash there. And it was about 3 teaspoons of chili flakes. And then it didn't give a measurement for sesame seeds or salt. It's just kind of however much you prefer. I just went ahead and mixed them all together in a bowl. I didn't do the 3 teaspoons of chili flakes though. Some people, chili flakes might be a little too spicy. But of course, as we start it later, if you guys do want some more spice, we can take care of you with that. So we're just gonna dump that all in there. And then mix it around. And as far as other toppings too, I've seen some recipes for carrot salad where you can put green onion even would be another good topping you can use. I even think if you just wanted to put like almost like a glaze type thing, just like a little bit of a teriyaki sauce, something like that. Of course, I do like spicy, so I would definitely be topping mine with more chili flakes. Now I think about it, sriracha might be kind of good to it too.
This would be a good like side dish to pair. It's also one of those dishes that gets better as it sits for a little bit and kind of marinates.
Yeah.
So the recipe actually sometimes they'll call for like sitting in the fridge for 30 minutes. You don't necessarily have that time today, but you could always pair this like on the side with some like if you did like some stir fry rice or anything like that, put some trying to think, what's the word? Gyoza on top, some of those things. I don't know if y'all
Oh,
Trader
like
Joe's. Yeah, they have
Yeah.
some of those really good ones. So this would be a good base for that as well. And a great meal prep to bring for work because I'm always trying to think of good work lunches. That's a battle for everyone.
All right, so that's all mixed. I think we're good to go.
Yeah.
So thank you guys for listening and hope you enjoy the salad.
Yeah. All right. Well, Dr. Savannah, we'll go ahead and welcome you up. Yeah, into the middle, right? Yes. I gotta make sure I'm in the right spot and get the Zoom too. Okay. Yep, you're good. Okay. Hi guys, my name is Savannah Huckaby. I'm an optometrist out of Sherwood, Arkansas. Just to preface this, I am not a good presentation, so you'll have to bear with me. I made this PowerPoint with this screaming 8-month-old this last week, and my husband's on a work trip, so we got through it, but we're here. Just a little bit about me. I went to Lone Oak High School, grew up there, and then I did go to Arkansas State for my undergrad education. So no booze, but after that, I graduated in 2018 and went over to Memphis to Southern College of Optometry and got my graduate degree there. Graduated in 2022, got married in 2022, and then started practicing in 2022. And I've been at the same location at my Sherwood clinic since then. This past January, I had a little boy, and so it's been a wild time in our life, but really fun. So Madeline asked me to come and talk a little bit about just how we use our eyes in this digital-based world that we're in, especially since COVID. We've seen just the amount of time that you're in front of the device skyrocket over the last couple of years. So it's a big topic with my patients, so they come in. So we could go into a lot of different things about it, but this is just kind of skimming the surface of a couple of really common things that I hear at clinic. So if we go to the next, yeah, there you go. Next slide. I just wanted to define it for us first. Digital eye strain is what we diagnose. And the Tear Film and Ocular Surface Society has this definition of it: the development or exacerbation of recurrent ocular symptoms and or signs specifically related to digital device screen viewing. It used to be known as computer vision syndrome. I just thought this was funny. They had to revise the, the term because when they first came up with it, everyone was on a computer, and now we have smartwatches and tablets and phones. And so they just broadened that definition a little bit. And so we're going to look at ways that impacts our ocular system, our neurological system, our musculoskeletal system, how we can kind of develop some healthy habits to reduce some symptoms from screen use. Next slide. So I just thought this was interesting, and again, kind of goes into some of the symptoms that we see. So the computer vision syndrome questionnaire, CVSQ, is something that we give to kind of quantify the symptoms that we see related to screen use. So there's a whole host of them that you see. A lot of the common ones that I see from my patients would be dry eyes, photosensitivity, blurred vision, headaches are a big one, heavy eyelids after looking at a computer or a digital screen. And I thought this was an interesting survey that they put out. In the University of Illinois at Chicago, they did a massive screening with a CVSQ with just shy of 2,500 undergraduate medical students, and over half of them had symptoms related to this. So it's definitely seen on a college campus with students and faculty members. Go to the next slide here. Yeah, sorry. So the next slide is just talking about a couple of risk factors that do increase your chance of developing some of these digital eye strain symptoms. Unfortunately, being female is one of them, and the reason for that is you're predisposed to dry eye. A lot of those symptoms overlap with each other, especially in front of a computer screen. Studies show that our blink rate decreases when we're focused on that screen. And so if you're a woman, it's just kind of in your cards. We typically see dry eye, we see strain, fatigue symptoms at some point. And so we kind of have to treat from there. Age is also a risk factor. The more birthdays we have, not all patients, kind of, yeah. The more predisposed we are to a lot of these same symptoms. And so again, we've got overlapping symptoms there.
The next one I find interesting, digital device use over 4 to 6 hours per day. And by the way, these are all listed on the American Academy of Optometry's website. They have a host of information, so you can look there. This one's interesting to me because if you work an 8-hour workday and you're on the computer all day, then boom, there's your risk factor, and that's most of us. Not even counting when you get home and look at your phone, or when you wake up and check your phone. So I think pretty much everyone falls under that category nowadays. Infrequent near demand breaks, and we kind of spoke a second ago about this, but the closer you are to something and the longer you sustain that focus, your system will eventually run out of endurance. And so everyone kind of has, I explain it to my patients, a battery for your focusing system, and you're going to run that battery low quicker if you're up in front of a screen closer, or if you don't give yourself any breaks. And so that's also a risk factor. Screen brightness is an odd one because there's a balance. A really low screen brightness is going to make you have to strain to see the words. And a really high screen brightness is going to cause some photosensitivity. So my suggestion is during the day, during the work day, try to find that balance of about 40 to 50% on the toggle for screen brightness. And that's where we see the least amount of symptoms. You want a viewing distance greater than 20 centimeters. Obviously, like we said, the closer you are, that's going to cause even more strain. And then we kind of touched on dry eye disease. So the next slide I have is just some, I don't know why the third bubble didn't pop up, but that's okay. We'll fill it in.
Hey, Savannah. Some of the Zoom can't hear if you can talk just a little bit louder. Sorry. No, you're fine.
It's really loud. Okay. So the first healthy habit that I have written down, you might have heard this from your optometrist before. It's kind of a tagline in optometry, but the 20-20-20 rule, basically, if you can think about it throughout the day, every 20 minutes, when you're working, when you're focusing on something up close, give yourself at least a 20-second break and look 20 feet away at least. And that lets your focusing system relax, and you can feel it happening. And it kind of resets, and then you can dive back into what you're doing. But that will decrease your chance of showing some of those symptoms related to digital use. Again, distance from the screen and posture around your computer, your desk is big. Making sure that you're about arm's length away is important. Obviously, sitting with your back straight will help decrease some of the musculoskeletal symptoms that we hear about, neck strain, back pain. If you're in a progressive lens, which is a no-line bifocal, you kind of want to position yourself a little bit higher than the screen you're looking at. And so that way, when you move your eyes down, you're finding some of that increased mirror power in your glasses, and you're not having to crane your neck back and cause neck pain. And so that's just a little tip with a no-line bifocal. The third bubble that's missing, the big mystery bubble, is to just examine your surroundings. So if you can manipulate the settings on your computer to decrease the amount of stimulus that you're getting, then that's going to help with some of those symptoms. If you have matte setting on your tablet, on your, I don't know if any of you guys read with a Kindle, that's better for your eyes. And again, just doing what you can to reduce glare in your settings. So if you've got a lamp behind you that's coming off of your computer screen, that's going to cause some symptoms to pop up eventually, some glare symptoms. So kind of trying to manipulate that where you don't have any glare coming from lights behind. And some of that is in your control and some of that's not. The last point I want to make is glasses versus contact lenses. I have a lot of patients come in asking me if they should be using their glasses when they're at a computer. And here's my answer that I give them. If you're wearing contacts, again, you're at risk of some of these same symptoms. Your eyes are going to dry out quicker. The blink rate, again, going down is going to cause contacts to feel less comfortable. And then with glasses, not only is comfort generally better, we can also add things like blue light blockers, which I'm sure you've all heard of. And that's what we'll kind of get into next. So there's a big blue light debate, and I have a lot of patients come in, and I think there's a lot of misconceptions out there that have to do with blue light. They're asking me when they come in, is it worth me putting this coating on my glasses? Am I going to see a big difference? And the short answer is yes and no. It depends, one, on the patient. Every treatment is individualized. But two, I think a lot of them come in thinking that blue light is damaging their eyes. Blue light has not been shown to cause damage to the retina. You're in fact exposed to blue light all day long, outside, under lights, around lamps. And so that's not causing damage to retina. It's not increasing your risk of ocular conditions such as macular degeneration. It's not causing age-related changes like cataract progression to go quicker. But it is linked to a lot of the symptoms we talked about in digital eye strain. And so there's kind of a correlation causation debate going on here with blue light and screen use. And so far, what we know is that most of those digital eye strain symptoms are more so related to the near stimulus and the focus stimulus versus blue light. But more blue light exposure does correlate with a lot of those symptoms. So anyway, it's not going to hurt to get a blue light coating on your glasses. If anything, it will help with some of those fatigue symptoms. The biggest thing we've been able to link to blue light and increased exposure is circadian rhythm disruption. And that is a whole nother PowerPoint another day. But just to kind of summarize, you could go to the next slide. And this is more so related to screen use at the end of your day, at night, when you're home. Using screens and getting a lot of that blue wavelength, blue light stimulus after the sun has gone down is going to almost mimic sunlight to your body. It's going to cause it to create less melatonin, and that in turn disrupts our sleep cycle, not helping any with headaches, fatigue, strain symptoms. And so we kind of get in this rhythm. So I do suggest to my patients who are on computers during the day, it's not a bad idea to have a blue light blocker on your glasses, or at least an anti-reflective coating to, again, cut down on glare. Some healthy habits relating to blue light. Again, we talked about having blue light blocking filters on your glasses. It's changing your device settings at night, particularly to dark mode or night mode. And then even if you can change the tone, you can use like a warm tone, that helps. And then this one again is hard. Avoid using screens 1 to 2 hours before bedtime. I don't know if anyone can do that or not. I usually scroll on my phone when I'm going to sleep. But anyway, some things to keep in mind. I threw this in here and I didn't start my timer, so if I need to hurry,
you're doing good.
Okay. This is something interesting that we've seen a lot lately. I do get to see a lot of the kiddos in our practice. I work with 2 other doctors who don't love seeing pediatric patients, so they all come to me. But anyway, we've seen a lot, again, going back to correlation and causation, we've seen a lot of correlation to some different things relating to screen use in kids. In Canada, they published a study that more than 2 hours of screen time for kids increased their chance of developing ADHD by eight times. So we see that correlation with attention deficit disorders. We see a correlation to how sedentary you are throughout the day. And so relating to childhood obesity. And this is the big one that we see in my practice, and that we try to treat as often as we can, but a correlation to myopia or nearsightedness. And kind of to get into that, what happens, and we can go to the next slide for this. When a kiddo is on a screen and they're holding it in front of them and they're developing, their system is going to adapt for this focal length and the amount that they're using it. And so their system is going to want to develop their natural focal point here instead of in the distance. And so we're seeing that more and more and more. The rate of myopia has tripled in the last couple of decades, with a big spike around COVID times, because we're seeing this in kids and their exposure to screens is going up so high. The problem with that is the body doesn't always know when to stop that myopia development. And so we're seeing as well of an increase in just normal myopia, severe nearsightedness, and that's increasing chances of health conditions, of retinal tears, of focusing deficits. And so there are different treatments that you can do for myopia control in kids. And again, we won't really get into that, but I just thought that was an interesting connection to digital use. So as a summary, basically what I came to say is make sure you're getting your yearly eye exams. There are some other underlying causes of these symptoms that match digital device strain. And one would be eye misalignment. And you can kind of see my picture here. This is a pretty good example of a noticeable misalignment. Not all of them are that noticeable. My brother is a case of this. He is at the University of Kentucky getting his graduate degree in Spanish linguistics. His computer usage skyrocketed when he got accepted into the program. And he called me, he's like, I'm just having double vision. I'm having trouble focusing, especially late at night when I'm up studying all night. And anyway, he came home his next break. I brought him up to the clinic. We did some eye alignment testing. And his muscles were wearing out later at night, and his eyes were reverting to their natural misalignment. He was having double vision. Well, there are things we can put in your glasses to help with that. One would be Prism, which is going to change where the images that each eye is seeing and cause them to get a little closer at helping your visual system bring those images together. With him, I was able to use just lens powers. And so he wears reading glasses at night when he studies. He doesn't like me to say, but just like my parents have to. But anyway, and that helped his symptoms greatly. And a lot of times that's something that's not discovered until you go to college, until you start a new job, and you're on a computer a lot more frequently. Focusing impairment is another one I see often. And again, this is a lot of times in kids, but it can be in college students too, or even adults starting a new job. Again, that demand goes up a lot. But we can see when I talked about like that focusing endurance, that focusing battery, people who have a smaller endurance naturally are going to struggle more up close whenever they start to run out of juice. And so I see that a lot too. And again, that can be helped by certain prescriptions, readers being a big one, or going into a bifocal a little bit earlier, giving you some reading help, taking the pressure off of your visual system to do all of the work. We can kind of supplement with glasses. And so all these things can be tested at your yearly eye exams. There are lots of other things that we check for. A lot of systemic conditions, high blood pressure, diabetes can cause changes to your eyes, can cause damage to your eyes. And so anyway, yearly eye exams, very important. Of course, having an accurate prescription is going to be a big plus and to prevent some of these symptoms as well. And so anyway, that's kind of the tagline. A couple of healthy habits for you guys, and then make sure you're getting your eyes checked on yearly.
Does anybody have any questions or anything? No, I'll ask the chat too. And just a reminder, y'all do get points for getting your eyes checked if you, submit proof of that. We do have a form you can take, or if you just snag a picture at the eye doctor or anything like that, we'll accept that. And I'm gonna go ahead and go to the next screen so that everyone can see where'd it go? I may have to go to a different one to show the certificate of attendance, but for y'all that are in person, you can also take a picture of this as well. What do we think of the carrot salad? Did anybody get to try it? What do we think? Good snack? Okay. Any questions or anything like that?
I have a question. If it is reversible, once like if you stop using your screen so much, if you
Absolutely, all the
Yeah.
symptoms are. If that is the main cause of those symptoms on that, that we listed, then yes, they're all temporary. So, yeah, limiting device, usage, implementing some of those different things, yes, definitely.
Not obvious in kids, okay?
Now that, we actively try to treat and combat. And so we have a couple of different ways we do that. A lot of that has to be treated in those developmental years. Typically around the age 14 and up, we don't have a lot of progress
Yeah.
when we treat. At least studies show.
Yeah.
So anyway, a lot of that is dealt with in those developmental years, so important for even children to have those yearly checkups. Yeah.
Right. No one had any questions in the chat, so, okay. Well, thank y'all so much for coming. We hope y'all enjoyed the carrot salad. We have lots left. If anybody wants to take some with them, you're more than welcome to have some to go, have the extra snack. And we hope y'all enjoy your handout and glad to see y'all.